I'm Ben Chapman, and this is Eating During a Pandemic. I've been a faculty member at NC State University for over a decade, and most of the time what I focus on are food safety issues. Things like E. coli, salmonella, norovirus in food, leading to outbreaks at restaurants, at grocery stores, illnesses that happen in people's homes due to food preparation and handling. And over the past 4 or 5 months, my entire focus and academic world has been upended, as has been for many people. My research, as well as the work that I do to take information to the restaurant industry or to farmers markets, has really changed in the face of COVID-19 and really has become an issue around food safety and managing COVID-19 in food settings. Early on, there was a lot of information that was moving back and forth and emerging around this particular virus. And because of what I do in normal non-pandemic times and spending time answering questions and developing science-based solutions for the restaurant and food industry, I got a lot of questions from people that we had done projects with in the past. And so as a result, the questions were really around how do we manage this virus? What's the best way to keep our staff safe? What's the best way to keep our customers safe? And what is the emerging information? What's the daily update? What's the news and what's new about COVID-19 as it relates to food and food safety? And so as a result, I've spent a lot of time over the past 4 or 5 months focused on this. And today I wanted to tell a story with the help of people that I've worked with and people that I know around what it's like for the restaurant industry to deal with a pandemic and really facing something that we've never seen at all in any of our lifetimes. And so throughout the focus of this podcast, I really want to tell this story using the words of people that have dealt with it on the front lines and have dealt with it as part of being in the food industry. One thing that's been really clear about working and existing in the midst of the COVID-19 pandemic is that there are a lot of things that have stopped, but there are a lot of things that can't stop. And one of those things that really can't stop is food. It's essential for all of us to live. And very early on in this pandemic, this is something that our national and state and local leaders really recognize, deeming food production, food manufacturing, restaurants, grocery stores as essential businesses. And so dealing with this pandemic and protecting not only the food of people that are consuming it, but also the employees that work at any of these businesses and the management and the ownership, that's been a big question that has come to us at NC State and my colleagues that I work with right across the US and elsewhere about what do we do? And so a big part of how we manage food safety questions is really getting a sense of what is happening, looking into the research literature about what we know about a specific risk or a specific virus, and then coming up with ways to manage that. And so through this situation, through this pandemic, I've learned a lot about the mentality of what's happening in kitchens and other things that I didn't really know about as it relates to supply chain of food and how people get and keep their employees, and really getting into the minds of things around how do we convince people that it's important to wash hands and to clean and disinfect and to wear face coverings. And so I really want to focus on many of those issues. For this podcast, I called upon some of the people that I know that I've been working with over the last few months and individuals that they've also known for a long time in the world of food safety to provide their perspectives. And so today you're going to hear from Lynn Mingus, who is the executive director of the North Carolina Restaurant and Lodging Association, Larry Lynch, who is a vice president at the National Restaurant Association, Colin Leonard, who is a manager at a local Raleigh coffee shop, Sola, as well as Veronica Bryant, who works for the North Carolina Department of Health and Human Services. Each of them has a different perspective on what it's been like to not only eat during a pandemic, but also regulate and come up with new strategies and management of making sure that people, both employees and customers, don't get sick during this pandemic. And so throughout this podcast, I'm going to use their words to illustrate some of the challenges and some of the issues that have popped up throughout this entire process. Let's start with Veronica Bryant. She's the Emergency Preparedness and Outbreak Coordinator at the Division of Public Health, Environmental Health section of the North Carolina Department of Health and Human Services. I've known Veronica for close to a decade, and we've worked together a lot on training and foodborne illness outbreaks. And Veronica is often the first person that I talk to in the regulatory world, in the world of food safety regulations as it relates to restaurants. And so in this entire outbreak, I really wanted to talk to her about what it's been like and how her role has really shifted.
Never in my wildest dreams did I think that I would be primarily responsible for control measures and guidance documents for respiratory illness, because my job was food safety. But, here we are. And in public health specifically, in every sector where people are in public service, the university included, we all just kind of work together to solve the problem at hand, which is getting control of this current pandemic situation that we're in.
One big thing that kind of gets lost or muddled in all the discussions around COVID-19 and SARS-CoV-2, the virus that leads to the illness, is transmission and how do people get sick. And so what we know is that the number one source, the number one risk factor for getting sick is really person-to-person transmission, being around other people, not wearing cloth face coverings or face masks, singing, laughing, yelling, talking, and those respiratory moisture droplets being transmitted from one person to another. But lingering in the back of many minds in the food world has really been this idea of, is food a transmission route? And well, let's hear from Veronica.
We've not seen any evidence that it is that it's linked to food or food packaging. So typically my job is, with foodborne illness outbreaks and what things can be transmitted through food. However, we regulate all kinds of places where people congregate, like restaurants, but also places like long-term care facilities and childcare centers. And so, when stuff like this happens and it's something that nobody knows anything about, the minute it becomes a public health crisis, the people making guidance and decisions have to be experts in something that no one's an expert in. And so those early days for all of us was a lot of research, which was difficult since there was nothing really out there to research. There was a lot of trying to draw parallels with some of the other SARS-type viruses like MERS and, the original, SARS, and looking at what information had been put out there, and then really trying to separate the important messages from, the overreaction or fear-mongering messages.
another person and really group of people that were also really concerned about misinformation and separating the good practices from some of the maybe not risk-based practices, and how that impacted how people felt about the food that they're eating and where they were getting it from, was my friend Lynn Mingus from the North Carolina Restaurant and Lodging Association.
One of the things we began to realize very early on is that we were going to have a lot of work to do to make sure that consumers felt comfortable coming back inside restaurants when we were able to reopen. We represent the interest of about 20,000 food service establishments across North Carolina and about 2,000 lodging establishments across the state. We have a team normally of around 10 people, and we work every day to educate and inform the hospitality industry on issues that matter to them and their business operation. We lobby before the North Carolina General Assembly on behalf of our members to try to get good laws and policies put in place that help the industry to grow and thrive and serve our interest collectively. And then we just are involved in networking and education of the industry in a variety of ways, making sure they have access to good information.
One thing that Lynn highlighted was this lack of information that was really definitive, and that's something that still exists today.
I think there's so much about COVID-19 that we still don't understand, both as citizens and as a hospitality community. At first we were told that face coverings were not needed, and today they're very much needed. In fact, we have a mandate in North Carolina that all citizens will wear a face covering in public. And so we're beginning to see people do that, although not nearly enough people are doing that. And that poses some problems because we know that the virus is very much among us, and new cases are happening every day. And so that presents a problem.
I also talked to Colin Leonard, manager of Sola, a coffee shop in Raleigh. This is really the front lines of this pandemic. And Colin echoed what Lynn said about information changing, and really one of the struggles that a restaurant or a business like his has.
The main unknown that we've got is that every new fact that comes out, I feel like I can only believe with about 65% of myself, because it contradicts yesterday's facts. I remember trying to decipher last week through a bunch of articles about quarantining, self-monitoring procedures. And from the CDC itself, depending on circumstance, I walked away with 5, 7, 10, 14, 21 day periods. And I was like, whoa. I feel like I have a pretty solid understanding. Because we are in the industry we are, we've got to be doing our research to make sure we're making informed decisions. But the quarantine period is changing. The recommended guidelines for social distancing have like ebbed and flowed slightly. That's been one of the more consistent. But you've got 6 feet for X and 20 feet for singing, and all these different feet requirements. You've got so many things that are changing so fast. At first everybody in food service remembers when there was the whole public freak out of, well, is the virus going to be sitting on the paper cup that Sola gives me? And luckily, it's not. But there's just so many unknowns that, because they're evolving so quickly, it just, and maybe it's skepticism on my part, which I would say that in a situation like this, I don't think that skepticism is necessarily a bad thing, because it would make us err on the side of caution. But there's just so many unknowns about all of it. How long is the period that you need to be around somebody? How close are you? What if you're wearing X, Y, and Z? What if there are these barriers? All these things are just continuously changing. Is it 15 minutes? Is it 20 minutes? So I think that it's just really the amalgamation of all the facts that are it's just like this mass that's adding things on and subtracting things from itself constantly. And it makes it hard to look it in the eye, if that makes any sense. Because I'll look at what I believe is the center of the problem, And then the next day, the center of the problem is very far removed from where I thought it was yesterday.
After getting Colin's perspective, I wanted to better understand if this was something just very specific to what we were seeing here in North Carolina or here in Raleigh. Was this something that we were seeing right across the U.S.? Just, information overload, information changing, and get a perspective from someone at the National Restaurant Association. So I talked to Larry Lynch, and Larry and I had worked together early on in the pandemic back in March to put together a webinar for restaurants nationally. And that webinar had over 13,000 attendees with people asking questions every second about things like how to do social distancing, airflow, focusing on issues related to cleaning and disinfection. And so I really wanted to get Larry's perspective on this.
I think that the restaurants knew that this was something they really hadn't been prepared for. And they're used to making sure that the kitchens are set up properly and they're designed so they avoid cross-contamination, and they can measure temperatures, and they know how to look at refrigeration and cooking temperatures. They have all that down pat. And the basics of personal hygiene were there, and, pre-shift discussions and at least some element of cleaning and sanitation. But now all of a sudden we had to take everything to a very new level. And this whole element of things like face coverings and social distancing came in. We're heavily engaged in all sides of food safety when it comes to restaurants. And one of my areas of particular interest and expertise is working in our certification components, where our food manager certification and other programs are accredited and support the training efforts that we do nationwide. So from our business operations to certification to science and industry to television and media, I touch a little bit of everything that we do in our organization.
This pandemic is not like anything I've ever seen. I've been around outbreaks and other illnesses in the food safety world for about the last 20 years. And clearly this is something very different and very new. It takes a different focus as scientists for us to really address something as so widespread and far-reaching as this pandemic. So I asked each of the people that I interviewed, when did they know that this was something different and something special?
But I started hearing about some of the issues that were happening in King County, Washington, and a retirement home there where they had a number of deaths, and certainly beginning to pick up the news on what was coming out of China, and a growing concern in the U.S. So much so, I didn't think much about it, except I think on my flight from San Francisco, and I was connecting, I think, in Dallas, and was watching the guy next to me cleaning off his table and cleaning off everything. I thought, oh gosh, here we go. And what really got me thinking is after he finished cleaning everything off, he started coughing all over me.
Well, we had begun to watch, national media, I guess just citizens in general had begun to watch COVID-19 and the kinds of things that were happening in other countries around the world. But I think sometimes as Americans, we think we're a little bit insulated from these kinds of things. We have world-class health care and good access to information. And so, I think most of us were kind of lulled into a false sense of security. We thought we were going to be okay early on. And then in early March, we began to see this virus taking hold in some of the western states, Washington, Oregon, California. And I think we then began to see business operations beginning to close. And I think it was around mid-March, we knew that we had a situation that was going to impact us in a very significant way.
The moment feels very clear to me. I was supposed to be on some sort of vacation, and I was at the beach, and I got the call that schools were going to be closing. And I think at that point, knowing one, that I couldn't remember a time when all schools everywhere had just closed down kind of for the foreseeable future. And we know now that extended through the end of the school year. So that was huge.
I think it was probably St. Patrick's Day weekend that we realized we actually need to drastically change some things. I think at that time, we still thought that it wouldn't be for very long. but we knew that there were some drastic changes that needed to be taken. We just didn't realize, I think in our heads it was maybe a month or two, or even just a few weeks. It wasn't fast forward now, it's the beginning of July, and things are getting worse than they even were in March. And so what do you do now? That was the weekend where we realized we've got to figure something out. We've got to basically come up with a new business plan overnight. When places were slowly starting to close, there was a couple cases that were reported in restaurants nearby, which made it feel a lot closer to home. And that was the weekend, I remember, on St. Patrick's Day, when all of the local news outlets were blowing up about kids at Glenwood South. And there was just a few signs. There was, these people at these bars, these restaurants are getting it. Fauci had just been given the driver's seat in the White House, and he is using his platform to say, guys, this is going to get a lot worse before it gets better. And so I think being leaders of a restaurant, we had to be really involved in the news at that time. We had kept a little bit of an eye on coronavirus, but then it started hitting closer to home. And that was the weekend where we started reading and listening and watching a lot more. And that was when we realized this is going to be something for all of us.
Dr. Chapman, I have never seen anything like this in my career. I've been a part of the hospitality industry for a long time. I served as our state's tourism director for many years, and weathered many uncertain times. We've had economic declines, recessions. I was at the helm of leadership for the tourism industry during September 11th, when travel pretty much stood still. We've been a part of gas shortages. We've survived hurricanes and floods. You think back to Fran and Floyd that played such devastation on our state when tourism and hospitality was interrupted significantly. I've lived through a lot of things in my 30-year career, but have never seen anything of this scope and magnitude and significant impact. And, I think the other part of this is that we don't see an end in sight. Unlike some of those other events that I talked about, there is an event and then there's an opportunity to recover. We're still very much living in this situation. It continues.
So we're in the midst of something that none of us had ever seen before. We have emerging information. The science is changing daily, but we have to do something. As I mentioned before, food is an essential service. And if we don't have food, society doesn't really exist very well. So what do we do? How do we manage this? And this is really where NC State and partners nationally and within the state of North Carolina really started to work together to figure out what are the best practices that restaurants need to have in place. What signs do we know? What signs don't we know? And let's build something where we can provide the best available information to the people that need it.
How do we do this safely? And then if and when the time comes that we can reopen, how do we get people to feel that it's safe?
So we did several things. The first thing we did was, as an industry, to put together a North Carolina restaurant promise. And it was a several-page document that outlined to the governor and public health officials commitments that we would make as an industry as a part of reopening restaurants across the state and food service establishments. And it included things, best practices that we had learned from public health officials and from folks like you, Dr. Chapman, who have always advised us here in North Carolina, but also, you're so well respected in the national arena. We had gotten some excellent guidance from the National Restaurant Association, CDC, FDA, and others on what reopening would look like as a part of best practices for restaurants. And so we articulated that in a letter, a public letter that we shared with the governor, and then shared this with a number of media outlets across the state. It said basically that we would follow whatever guidance was given to us, including the wearing face coverings, having table space 6 feet apart, doing employee screenings, posting signage, that we would operate at a limited capacity, and that we would work with public health officials to determine what that might look like. And so we shared that with the governor, and had really good response from him on that, and from public health officials. And so we developed a program that ultimately was called Count on Me NC. And another component of that was a training protocol that we then came to North Carolina State University and you, Dr. Chapman, to help us develop this training program. We knew that, we can't just tell guests coming into our establishments that we're doing everything well. They have to have comfort that we know what to do and that we're adhering to best practices. So Count on Me NC was born, and it is a collaborative partnership that continues today with the North Carolina Restaurant and Lodging Association, the North Carolina Department of Health and Human Services, NC State University, who has developed an expansive training curriculum, and then finally Visit NC, which is our state's tourism office that plays an important role in bringing visitors in our state and getting North Carolinians to travel within their own state.
The work was done, like you said, so rapidly and in such a collaborative way. And, going back to the idea that, this is all brand new stuff and we're just learning about this as we're going. We were developing high level, really quality course content in a short period of time for development, but also in a short period of time from what we knew at the time. I mean, we really had to do a lot of research and come a long way pretty quickly. So that was pretty incredible to be a part of. And, just to see us all be able to come together with all of our different perspectives and all of our different goals and to complete that. It's one of the things that I'm the proudest of in my career so far.
It's not enough to just create the material. It has to get out there into the hands of people in the restaurant industry, in the cafes, into the grocery stores, and they've got to do something with it and take a look at their own business and look to see exactly the types of changes that they have to make. And so I talked to Larry as well as Colin about the changes that they had heard about from specific restaurants and other situations.
I think it's been a creative moment for all of them. I share with somebody the very first restaurant that I walked into was one of my favorite places here in Orlando. And I was actually going for takeout. I was going to pick up, but they were open. And I kind of chuckled because the tables weren't just 6 feet apart. The tables were about 20 feet apart.
Yeah, so Sola is a coffee shop cafe that's in North Raleigh. It's kind of in the middle of a neighborhood. It's in this really funky shopping center that you wouldn't think has as much life as it has. It's where the first Gonza Tacos and Tequila came in. And we're on the other side of that plaza. And it's this really weird amalgamation of a ton of neighborhood regulars that come in. But between Gonza and Sola, it's also now a place that people will drive all over the city just to come and enjoy, which is really unique. I am, I guess, one of the managers there. My wife, Sally, is the daughter of John and Jeannie, who started Sola. And we just kind of help out in whatever ways are possible for them to make running the business a little bit easier. So I've been there for 4 years now. And it's just this incredible shop where people come together and get to hang out and get to enjoy really good food and really good coffee and specialty drinks that we do. Just hang out. And that's obviously that last part of what Sola is has been the thing that's most directly affected by COVID, because a place to go hang out doesn't really exist in the same way that it did 6 months ago. We always say that to work at Sola, you've got to be a little bit insane, because you just, it's like walking into a boxing ring and you are the punching bag for your shift on some of those busier days. But you just love it. You come back because you get to see people. You're getting to make great food and drinks. You get to be an employee at one of the centerpieces of community in North Raleigh. The heart of our business is community. The heart of our business is the people. It's the relationships that we develop. I met my roommate that I lived with for 1.5 years before I got married. He's a customer at Sola. It's just friendship. It's community. And feeling like we were going to lose that because we had to close our indoor dining space, or we couldn't be next to people in the same way, or you're wearing a mask and you can't understand people as well. People are skittish. That was probably the biggest challenge, was getting over that that hurdle of what is it going to look like to maintain our integrity while also staying in business. We've been open for 7.5 years. So for 7 of those years, we were open for normal dining. It's a counter service. You come in, you order at the bar, you sit down, we call out your latte, we'll bring your food right to your table. And that's what we've done for 7 years. And then overnight, we're no longer doing for here silverware and dishware. There's none of that. Everything's to go. We, for a week, allowed people in the building to order to-go food. And then we thought, this is a bad idea. So we went from somewhere where people come and spend their time together to curbside only. You interact with us on the phone, and the only person who sees you is the person who's coming out, mask on their face, gloves on their hand, handing you food through the window of your car. And sometimes they get to talk to you for a minute or two, but most of the time there's 7 other cars waiting behind them, and it's, hey, great to see you, gotta go. The way that we've got it set up, we really are trying to protect everyone as best as we can. So as far as our interactions go with the food, everybody's wearing masks. If you were appropriately following health protocols before, there weren't in the kitchen a ton of changes that needed to be made in the actual practice of making and prepping the food. For the front of house, now our roles just look different. We don't have food runners. We don't have people in the same capacities. We have, multiple people answering the phones. Everybody's wearing a mask. And we have one person at a time who's dealing with customers outside. They're gloved, they're masked, they're staying away as best as they can. We're not taking anything from customers. Everything is still zero contact. If there is like an off chance where I've been running food to a car before and a dog will nuzzle up against me, or I'm setting the food in the seat and a customer will accidentally brush my glove. Okay, great. I'm going to come in. I'm going to change gloves.
One of the things the pandemic has done is really put a focus for the restaurants on their pre-shift discussions, rather than waiting until somebody comes in and says, "Oh, I don't feel good." They're getting them out before that ever has to happen. And so this now really comes down to help us understand what this whole idea of asymptomatic transmission means. What's the genuine risk? How close can our people be to the customers? What do we have to have for air exchange? Is an open window enough? Should I have a fan blowing somewhere? And I think that's where they have the least consistency and the biggest worry.
This pandemic has changed a lot about how we eat, and it's not just in restaurants. It's also the supply chain on how we get food from farms through distribution and warehousing to grocery stores and to restaurants.
And one thing that I didn't realize, as a consumer, I would go to the grocery store and see, that groceries were limited, and I couldn't figure out if it was just because people were hoarding or what was happening. And through that group, I realized that our food supply, in terms of the distribution chain and how things are packaged and managed, relies on the fact that, it's something like 40% of meals in the U.S. are typically purchased in a restaurant or dine-out type experience. And so when that shifted to almost 100% of those meals being made at home, it wasn't just that the grocery store shelves couldn't keep up, but, food was packaged in, the large restaurant-sized cans that were not really able to be broken down and sent to individuals. And meat was packaged in crates or boxes and not for individual families. And there was just a lot around it. So it was pretty clear that we needed people to, at least start feeling like they could choose restaurant options again to alleviate some of that pressure on the food supply. And so to me, that was a big driver in this, is not just the jobs and the economic impact of restaurants being open and dining out, which is hugely important, but there was a real necessity from a food supply chain to start having people getting their meals from the places that were common before the pandemic.
So where do we go from here? What do the next weeks, months, years look like as we deal with COVID-19 in the restaurant and food service and food industry? What are the uncertainties that we have?
Some businesses, even though the government does not require them to shut down, are having to close because they don't have staff. Their staff is, sick with COVID, and so that's having an impact. We're seeing that in meat processing plants and seafood processing industries. We're seeing that in other settings, and we're seeing that in the hospitality industry. So that's raising still another concern that we're having to deal with.
It's a group of people that need to make a living. They want to make sure that people who work for them make a living, but they also want to make sure that everybody does it safely. And I think the more access we have to science on something that really it's new to all of us. And so the more we can get answers, the better the experience is going to be for people. I had this discussion with the CDC last week. It's this whole question of air exchange. And there's so many variables. And I know there was an article in this morning's New York Times talking about that. And again, it's in this particular case, it was a group of scientists arguing with the World Health Organization and its take. But even CDC, when I was talking to them last week, really doesn't have anything definitive yet.
I think the hardest part about deciding to open a cafe is that, our risk right now, like I just said, is outside the workplace for our employees. And if we open the cafe, we are introducing that risk on a much higher level because it's people that we have no level of control over, no level of knowledge for. And that is what is really unsettling about people being back inside. And I know a lot of our regulars well. I trust a lot of our regulars, but there are people that I just don't know, and that's a scary thing to trust them with. So what we've done over the last couple of weeks is we opened outside seating, which has always been something that people have loved about Solo. We've got a great patio for seating, and we've measured the tables in a way to where they're safe. We have someone whose sole job it is to be outside disinfecting each table after use, making sure that the disinfectant has enough time to sit so that it kicks in. So that has been like a very controlled segment of reopening, I think, to provide a semblance of normalcy for both our staff and for people. Again, the heartbeat of Solo's community and trust, and we want the trust of our community. We want them to know that we're doing everything we can to keep them as safe as possible. And I think that one way that we could easily break that trust is by opening too early when we're not ready. And when the world's not ready for it yet, we want to make sure that they know they can trust Solo.
And I think that's the unique challenge here is that we're not sure how long this is going to continue and how devastating the impacts are going to be. And so, that makes it really hard to respond appropriately for business owners and for those of us, as citizens. It's an ongoing challenge, and we're doing everything we can to persevere through it. But this is a challenge unlike anything we've ever seen before.
I learned about communicable disease law and isolation and quarantine orders early on in my career, and it was kind of one of those things that was reserved for tuberculosis or the end of the world, basically. Like, you didn't really think about it as something that would ever really happen on a large scale.
And this is something that's happening at a large scale. It is something that's affecting all of us internationally, here in the U.S. and globally. Our food industry, our restaurant industry. This is an event, this pandemic, eating during this pandemic is going to be something that we continue to deal with as we go into the future for many months and possibly years to come. In my live stream event next week, we'll delve more into this topic, and I welcome your questions, and I look forward to our conversation.